7 signs and symptoms of fatty liver. Treatment to reverse non-alcoholic fatty liver disease. In this video, you will learn about the top 7 symptoms and indications of fatty liver. Continue watching until the end to learn how to reverse fatty liver disease. This video, as always, is for educational purposes only and does not constitute medical advice. We are not doctors. Welcome to the Health Hub, where information meets motivation and wellness, creating more connected health tips to help people on their path to better health. To begin, what exactly is fatty liver disease? The liver is a vital organ that performs numerous functions such as nutrient metabolism, bile and urea production, toxin removal from the blood, and vitamin and mineral storage. When the liver contains extra fat, an inflammatory reaction is induced. This results in antibodies attacking and destroying liver cells. Damaged liver cells are unable to operate normally. As a result, the liver is unable to detoxify and perform its other functions, leading to buildup of fat. This disorder is known as hepatic steatosis or fatty liver disease. The most prevalent kind of non-alcoholic fatty liver disease is fatty liver, or NAFLD. When the accumulation of fat exceeds 5 to 10% of the liver's weight, it becomes harmful. As the liver becomes fatter, it can induce fibrosis and cirrhosis, the stage of liver disease characterized by irreversible scarring and severe scarring. Now that we understand why fatty liver is harmful, let's examine its 7 symptoms. Appetite and weight loss. In liver damage, especially in the severe stage of fat accumulation, hormones that regulate hunger become with liver damage, particularly in the severe phase of fat storage. Hunger-regulating hormones become disorganized. Leptin is a hormone that controls appetite and decreases food intake. When leptin levels above the usual average, appetite suppression and weight loss may result. Weakness and tiredness. Fatty liver disease may produce fatigue if you lack motivation for physical and mental activity, have muscle weakness, and feel sleepy. In research conducted in 2008, patients with fatty liver disease had greater weariness. Considering the liver's fundamental function in energy metabolism, this is not surprising. The liver connects with the skeletal system, the intestines, the neurological system, and fat-storing adipose tissue. As fat accumulates in the liver, this connection is impeded, and the muscles, intestines, and nerves begin to malfunction. Increased liver blood enzymes. Several enzymes are produced by the liver to metabolize nutrients, medicines, hazardous substances, and other metabolites, or the products of metabolism. The primary enzyme that indicate liver impairment are liver aspartate aminotransferase or AST and alanine aminotransferase or ALT. 25 to over 50% of patients with fatty liver disease had high AST and ALT values. A rise in these enzymes might indicate fatty liver disease. Edema or abdominal pain. Inflammation of the liver cells is caused by fat buildup. Inflammation leads immune cells to attack tissue. Fluid retention and edema can be caused by tissue damage. You may experience pain or discomfort on the upper right side of your abdomen, where your liver resides. The accumulation of bile duct stones as a result of fatty liver disease could also be a source of pain. Bruising and bleeding. The liver generates platelets, a type of blood cell that aids in clotting to prevent bleeding. In cirrhosis, the advanced stage of fatty liver disease, platelet synthesis is diminished. When blood is unable to clot, bruising and even bleeding might result after an injury. Moreover, the individual may develop jaundice, itching, and swelling. Gastrointestinal problems. Gastrointestinal disorders affect the organs of the digestive system, including the mouth, stomach, and intestines. In a 2019 study, the digestive symptoms of patients with liver cirrhosis were evaluated. About 50% of patients reported abdominal bloating as the most prevalent symptoms. In addition, 13.3% of patients developed diarrhea and 8% suffered from constipation. Nausea and acid reflux. The prevalence of gastroesophageal reflux was higher in patients with fatty liver disease, according to a 2009 study. In addition, Some individuals suffered increased acid reflux and belching. The condition of gastroesophageal reflux occurs when stomach fluid moves back up into the esophagus. It may result in nausea and vomiting. Moreover, the inability of the liver to remove toxins and waste products damages the stomach and esophageal mucosa, causing reflux. So there you go, the 7 signs of a fatty liver. If you detect these signs, you should get a blood test, ultrasound, or biopsy to confirm the health of your liver. Unfortunately, this condition is only curable via dietary and lifestyle modifications. Here are 8 things that you can do to prevent and reverse fatty liver disease. Number 1. Regular exercise. Aerobic exercises like walking, running, cycling, and Zumba can boost fat burning while decreasing fat synthesis in the liver. Number 2. Maintain a balanced diet. A healthy, well-balanced diet is of the utmost importance. Because the liver converts food to energy, any excess of carbs, proteins, and fats are converted to fat and accumulate in the liver. Incorporate liver detoxifying foods such as cruciferous vegetables, artichoke, turmeric, walnut, milk thistle, and coffee in your diet. Number 3. Reduce your alcohol consumption. Alcohol causes fat to accumulate in the liver. When alcohol is broken down in the liver, an enzyme converts it to acetaldehyde, a carcinogenic cancer-causing compound. Number 4. Keep a healthy weight. Even a 10% reduction in body weight can reduce fat formation and assist in reversing fatty liver disease. Number 5. Eliminate high fructose corn syrup. HFCS is comparable to, if not worse than sugar. When excessive amounts of fructose enter the liver, they are immediately turned to fat. Check food labels and avoid HFCS containing packaged food. The names glucose fructose syrup, maize syrup, tapioca syrup, fruit syrup, and crystalline fructose are used to mask HFCS. Number 6. Cut off sugar. Sugar can cause weight gain and an increase in blood glucose levels, particularly in those with pre-diabetes and diabetes. Elevated blood glucose levels result in hepatic and fat buildup. Eliminate processed sugar packaged foods and commercial fruit juice. Number 7. Avoid using medications whenever possible. The liver is essential for removing toxins and waste and for drug metabolism. Using unneeded medications might deplete liver cells and exacerbate the inflammation caused by fatty liver disease. Number 8. Eat fiber-rich foods. Fiber can help lower your blood lipids, triglycerides, and LDL, or bad cholesterol. Try to eat at least 5 servings of fruits and vegetables per day. Other fiber-rich foods to consume include beans, lentils, and gluten-free whole grains. Who is vulnerable to fatty liver disease? Fatty liver disease risk factors include obesity, age over 50, a family history of liver disease, sleep apnea, diabetes, elevated blood lipids, and excessive alcohol consumption more than 14 drinks per week. Hopefully this video has answered a couple of questions. Please remember this is not a medical advice. Please visit your doctor. Thanks for watching. If you enjoyed, please give us a like, subscribe, and comment for more health tips.